My name is Charlotte, and I partnered with Ecología, Desarrollo, Salud y Sociedad, or ECODES, for my internship titled Framework to Predict Dengue Transmission Across Urban and Rural Areas in Northwestern Ecuador. Dengue fever is a disease transmitted through mosquito bites, and it impacts millions of people every year. Dengue transmission is very complex, making it hard to predict. Researchers and policymakers generally consider dengue to be an urban disease because of high population density in most cities, but there's evidence that dengue cases are increasing outside of urban areas. Dengue transmission is much more complicated than just population density. Many factors determine mosquito abundance and human vulnerability. Transmission depends on biological factors like the types of mosquitoes in the area, environmental factors like precipitation and temperature, infrastructure like the presence of reliable piped water and access to healthcare, and social factors like human movement, for example, by car, or relevant to parts of our study site by canoe. Because these factors vary across urban and rural areas, researchers and policymakers need a better framework to predict dengue transmission across all environments. For my internship, I partnered with Ecología, Desarrollo, Salud y Sociedad, which stands for Ecology, Development, Health, and Society, or ECODES. This is a research group that works to understand infectious disease transmission and support community health in Esmeraldas province, Ecuador. They have worked on, they initially started looking at diarrheal disease. In 2017, they've started their dengue study. Since then, they are also looking at gut microbiome and zoonotic E. coli. So many different types of infectious diseases. Not pictured, they also do community health work. So in this internship, we developed a framework to predict dengue transmission in northwestern Ecuador by combining environmental, social, biological, and infrastructure factors that determine mosquito abundance and human vulnerability. Our new framework can help professionals prevent and monitor dengue outbreaks by better predicting where these outbreaks will occur. I have created a one-page document to share with the framework with policymakers like the Ecuadorian Ministry of Health and the Pan American Health Organization. And I'm also contributing to a peer-reviewed manuscript to share our framework with researchers. So I want to thank Dr. Joe Eisenberg for mentoring me on this in this internship. I also want to thank Dr. Jim Trossel for all his mentorship in the past and for developing this idea for a new framework. I also want to thank the ECODES team, the communities and participants in Esmeraldas Province, Ecuador, the University of Michigan School of Public Health Epidemiology Department, the A2 CARES Center, which is the Asian American Centers for Arbovirus Research and Enhanced Surveillance, my departmental National Institute for Environmental Health Sciences training grant, and BU Urban, especially Emily Walton for all her support, and BU Urban is supported by the National Science Foundation and internal BU funding. Thank you.